Good afternoon, everyone. Thank you for tuning in. On behalf of Manila House, this is Bambina Olivares, the Director of Programming, welcoming members and non-members alike to today's webinar, Herd Immunity, How Israel Beat COVID-19. Israel started its COVID-19 vaccination program as early as December 2020. Success against the pandemic can be attributed to bringing in the vaccines early. In addition, Israel has a great public health system with very strong HMOs, or health maintenance organizations. Approximately 5.5 million in Israel have had the first jab, and more than 5 million have received the second dose. Israel has a population of 9.3 million, and Israel uses only vaccines manufactured by Pfizer. With us today is the Israeli ambassador to the Philippines, Rafael Harpaz, who will share Israel's experience and knowledge in emergency and pandemic response. Ambassador Harpaz arrived in the Philippines in August 2018. Prior to his designation as Israel's ambassador to the Philippines, he served as a director of the Ministry of Foreign Affairs, Central Asia and Caucasus Department since December 2015. He was also Israel's ambassador to Azerbaijan, director of Public Affairs Department in the Embassy of Israel in Washington, D.C. He also served as deputy chief of mission in the Embassy of Israel in Stockholm, Sweden, Bern, Switzerland, as well as Abidjan in the Ivory Coast. I'd also like to welcome today's moderator, the seasoned, multi-awarded journalist, Ces Gilon, who we are proud to call a Manila House member. In fact, both speaker and moderator today are members of Manila House. Before we begin, just a few ground rules. This webinar is being recorded and will be up on the Manila House YouTube channel in a day or so. Please use the chat box and the Q&A box for any questions and comments, and we'll get to your questions as we go along. Thank you. Now, Ambassador Harpaz, I shall turn over to you to unmute. Yes.
Okay, can you hear me?
Yes, perfectly.
Hello, good afternoon, everyone. I'm very happy to attend this event. I will try to walk you through a bit how Israel beat COVID-19, but first, to put it into context, I will say a few words about Israelo-Filipino relations, which are important to mention in this forum. We have very friendly relations, and the basic for these relations are first and foremost two historic decisions by former Filipino presidents. In 1939, President Manuel Quezon, when Nazi Germany was so dominant in Europe, when the Holocaust was arriving, when Jews have no place to go, the Philippines opened its doors for Jews fleeing Nazi Germany, and 1,300 of them found shelter in the Philippines. Then 8 years afterwards, the United Nations had to vote yes or no for the creation of the Jewish state. If it was no, I wouldn't be sitting here today with you. And the only country in Asia that voted yes was the Philippines under President Manuel Rojas. We will never forget it. We'll never forget it. And from the Israeli side, Israel has trained tens of thousands of Filipinos along the years on agriculture, on irrigation, on public health issues, on gender issues. Then Israel is cooperating very closely with the Philippines on counterterrorism. In addition, when you have Typhoon Yolanda, Israel came here. One of our biggest relief operations in the history was here in Leyte in 2013. And also during COVID, we brought, and I'm proud to say, Israel was one of the very active donors country to the Philippines by assisting the Philippine National Police, the Philippine Armed Forces, the Department of Education by providing protective equipment for the first responders, distance learning material, and also sharing our information. Actually, next week, a high-level Israeli delegation will arrive to Manila from our Department of Health and other agencies to share our experience with the Philippine government. Then I'm so proud, I'm very, very proud that Israel was, as far as I know, the first country in the world to vaccinate the Filipinos OFWs in Israel. Almost all day, it's open for them, no charge. 30,000 Filipinos, almost all the 30,000 Filipinos OFWs in Israel are vaccinated by us, by Pfizer. In addition, the hundreds of students of TESDA and the Filipino staff of the Filipino embassy in Israel. Every Filipino caregiver that travels now in those days to Israel is a caregiver. When he lands in Israel, he receives immediately the first dose of Pfizer. And after 21 days, he received the second dose. So I'm very, very proud with it. So it's a great honor. When we are speaking about Israel's success in beating COVID, there are 5 pillars of this, and I will walk you through. The first one is as you just mentioned, we got the vaccines. This is the most important. We have the vaccine. We got it first in December. Israel started its national vaccination program on December 20th. I think we were one of the first or second country in the world to do so. Second is our HMO system. Third is our high-tech society and high-tech technology. When the data is being spread all over, you get the vaccine, all the government systems knows that you have been vaccinated. Fourth is a role model of being vaccinated by our leaders. And fifth element is a campaign to fight fake news and to promote people to go and be vaccinated and to give incentives to those that have been vaccinated. So I'll walk you a little bit through the timeline, and then I will be more than happy to take some questions. When the first lockdown started in Israel, the 14th of March 2020, it was 2 days before the lockdown came to Manila. We closed all the economy around this period. The first death case in Israel took place on the 20th of March 2020. And then right before the week of the Holy Week, and for us it's the Jewish Passover, there was a very strict lockdown. And already in April 2020, there was a regulation to wear masks. Now, I know in Southeast Asia, you're more used before COVID to see people with masks. In Israel, the only people I saw in masks is people at the emergency room in the hospital, not more. So we are not used to it. And after 1 month, life became very normal. From May to August last year, I was in Israel, hardly no mask, very normal time. And then when school started in September, that's what they was called, the number went up dramatically. And there's the period of Jewish holidays coming early October, and then there was a second lockdown. And then the third one started for 1 month in December. And then in last February, it went down. And today, no masks in Israel, not inside, not outside, and actually hardly we don't have COVID and no restrictions. The number of sick people went down dramatically, and what caused this change? First and foremost is the huge vaccination campaign. The fact that Israel was capable of getting those millions of vaccines and being among the first countries in the world to receive it, this is the success. We got both Pfizer and Moderna, but we have used as far as I know only Pfizer. The government of Israel signed recently for additional 16 million doses with Pfizer and Moderna. We don't need it now, but for a potential third dose or a booster in 2022. So we're already planning towards the future. And Pfizer saw Israel as a great, with the very advanced health system. There was in December, we didn't know what will be the side effects. Now, when you Filipinos are being vaccinated now, we know what are the side effects, which are very limited, by the way, when it comes to Pfizer, when we have it in Israel. But in December, that was a new thing. So we were some kind of the laboratory for the world, and it's a success story. I can tell you that after being vaccinating 5.5 million Israelis, the Pfizer protects you 96% for getting sick at all. And among those 4% that might become sick, almost most of them will be asymptomatic or very mildly sick. And it seems to be that probably they are not transmitting the disease. The other element was while we started the campaign of vaccination, we did a lot of tests. And the peak of it, we have at least approximately 100,000 tests anymore. Now, Israel is 9.3 million people. And don't forget that more than 2 million are very young people that can't be vaccinated. It was under 16. Now, the vaccines are open for the ages of 12 to 16 in the last few weeks. But then, no. So it was really an impressive amount of people that being tested every day for free, no cost. And that was very important to find who is sick, who is not sick. And then at the peak of the vaccination campaign, we vaccinated 200,000 people a day, a country of 9.3 million. It's an enormous number, drive-through, through the HMO. It's amazing. So tests per capita, we were leading the world in tests per capita. What was also important, you can purchase vaccine in Israel. Private sector is not, it's only government that brought the vaccines to Israel. They are the only one that allowed to do it. And we are very, very, very proud to have those HMOs. In Israel, we have a national health law for every Israeli, by obligatory. If you work, if you're unemployed, if you're a student, you have to be affiliated to one of the biggest HMOs. It means that you have your family doctor and all your specialized doctors. For your HMO, it's a neighborhood clinic usually. And everything is computerized. I can enter from any place in the world to see my blood test, whatever. And they are the one that conducted it. And they did it I'm so proud. You have to see how it worked. You get this, it's like a Swiss clock. And it's worked very, very well. So I'll give you the example. You go and you set the date online for the vaccine. You go, they set you a time, you have to come 2 p.m. You get the vaccine right on time. You have to wait 15 minutes if there is any side effects. While you are waiting for the first dose, 15 minutes, you get a text message that tell you this is the invitation for a second dose 21 days afterwards. They keep the dose for you of the same vaccine. After 21 days, you go again, you get the dose, you wait 15 minutes. During those 15 minutes, you receive a text message with a link to what we call a vaccination passport. It's in Hebrew and English, tells you which vaccine you have received, which date you have received the first one, which date you have received the second one, and the validation of it. The validity of the vaccines at the beginning, we didn't know in December how long it will last, was 6 months, and now it was extended for 1 year, according to our experience, and we'll see what will happen after 1 year. From what we have seen, the side effects are very, very mild. In Israel, the first dose, mainly some pain here on the shoulder. Second dose, people have a bit of a fever, but after 2 days, everything was done, was over. The weak spot in Israel was the airport. So many Israelis came back and traveled, and we opened the borders to go to some certain countries, and that's where the different variant entered. It was a major challenge for us until we understood that we should work differently, reach an agreement with some countries, or what we call green countries, that we can accept both countries' vaccines, and then you enable people to come. And a very, very challenging task, while finding the right balance between we need the economy to move forward. People were unemployed, and you have to keep the public safety of the population. And then comes the issue of role model. The first person that received the vaccines, prime time, 8 p.m., live on television, was the Prime Minister of Israel. The day after, it was the President of Israel. And there were also a few other celebrities that were vaccinated live because there were so many. There were fake news, it's one thing, but there are people that really have, they were afraid. It's a new vaccine, how we dealt with it. And that was a great success. I think that was a role model for all of us. We did it at the beginning gradually. We started with people above 60 years old and people with previous medical cases, history, and then it went down. And today, everyone in Israel, if you come, you just get the vaccines. And that's it. There is no, and we saw actually not dahan, bilis, that the numbers of 6 people, and especially those in ICUs and severe cases, went down. And we saw that most countries in the world were looking at Israel to learn from our experience. That was very, very important. Fake news was a big issue, and we're not only in Israel, by the way, it's all over the world. By the way, I call every Filipino that watching us, when he has the opportunity to be vaccinated, go and be vaccinated. It saves life. It saves life. That's the bottom line. We also, by the way, vaccinated, for example, the Palestinians workers that work in Israel, and as I mentioned, all of OFWs, and even illegal, those that are staying illegally, overstaying in Israel, were vaccinated by us. The challenges for us were in Israel, and difference for the Philippines, we have elderly homes. That's where, here, there are 2 options in Israel when you're elderly. Either you have a Filipino caregiver at home, and thank you for the Filipino caregivers for taking such a good care of the Israeli elderly at their homes. They're amazing. But also you go to an elderly home. That's where the place where at the beginning the pandemic hit very badly. By the way, not only in Israel, many other countries. And Israel was the first country in the world to vaccinate all its population of elderly that are at those elderly homes. We made them sterile, and it will enable grandparents to see their children and grandchildren after a very long time. Then the other element was the element of data. And in Israel, again, everything is computerized. So if you've been vaccinated, every HMO that you go, every hospitals, we know if you've been vaccinated. If you have to be in quarantine, they will know. If you've been sick, they will know. So that's how you manage it, and that's the right thing to do. What was also important is we have several Israelis, quite a number, that became sick between the first and second dose. You feel very safe, very confident after you receive the first dose. And again, there's to be 3 weeks, 21 days between the first dose and second dose. But the guidelines in Israel were very clear. You are fully protected a week after the second dose. So there are 28 days that you have to be more vigilant and more cautious. And it has proven itself. It has proven itself. So you have to wait for 28 days. And we saw that the vaccine is also very efficient for people which are above 70 years old. In addition, we needed to give incentives to people to become vaccinated. Now, we can't force people, you can't force people to be vaccinated. In Israel, it's against the law, it's against the human rights of every person, but you can give incentives. So the incentives, and we gave the green badge. Now it's not necessary because there's hardly no COVID in Israel, which means if you're vaccinated, you can enter to sports events, to rock concerts, to theater, to shopping malls and places like this. More important, if you travel abroad, and all the Israelis are just waiting to return to the Philippines, to Boracay, to Palawan, to Banaue, to Manila. So Israelis are traveling. So we reached with some countries like Greece, like Cyprus, and some other European countries, bilateral agreement of mutual recognitions of vaccines, which means if you're vaccinated, Israel until now, we recognize Moderna and Pfizer. I know there are discussions about AstraZeneca. We don't have AstraZeneca, so it wasn't relevant. But then it will enable those Israelis that want to go to Greece or Cyprus or Hungary for vacation and being vaccinated, probably they need to do a test before, and that's it. And the same dose that will come to Israel. We recently opened Israel for tourism very carefully. The first group starting to arrive with a very clear protocol because we need to be cautious with the different variants. And again, now no masks. Life is normal in Israel. Life is normal in Israel. Life is totally normal in Israel, which makes us very proud. We have to stay vigilant. You know, this virus, you don't know how it develops, and I hope and I believe that the Philippines will reach this stage when you have that the numbers of the percentage of people that are vaccinated will become higher. But we have this herd immunity, which is very, very important. Then Israel is also at the forefront of developing a cure for COVID. There was a trial, I know it was well covered in the Filipino media, in the Ichilov Medical Center in Tel Aviv, of a medicament which based on a biological protein. And it's based, actually, it's a treatment that was based on research on cancer. And they gave 35 people that were sick, hospitalized with COVID, got this treatment as a trial, stage 1. 32 of them left the hospital after totally healthy after a few days. So now it's in stage 2. You need to have tens of thousands of people to be tested. And I think they're doing it in countries that have really a significant amount of people that are being vaccinated. But it seems to be that it's working very, very, very well. So that's where we are. We are more than willing, and we are going to share our experience with the Philippines. And it's a blessing that you know, the new normal. It's a challenge. I'm happy to see that the Philippines is getting better and the lockdowns are getting better. And as I told in the beginning, PAL is starting to fly to Israel directly, hopefully in October, direct flights. And in normal days, one-lang visit for Filipinos. And direct flights, you can reach to Jerusalem, Nazareth, the Sea of Galilee, the Dead Sea. So I invite all of you, when COVID will be relaxed a bit, to travel to the Holy Land. Thank you very much, Ramin Salamat. Thank you.
Thank you so much, Ambassador. Let me turn you all over now to Ces Jalon, and she'll moderate a discussion with Ambassador Harpas. Ces?
Thank you, Bambina. Good afternoon, Ambassador Harpas.
Good afternoon. Good afternoon.
Thank you for accommodating us, even as you are busy winding up your affairs here in the Philippines. We'll be very sad to see you go. How time flies, no? 3 years can pass so quickly.
Correct.
Well, I just like to throw the first question, a few questions, but of course the attendees here will also have their opportunity to ask questions of you. One is, how crucial was, Israel always views events like this from a national security perspective. The fact that a national security approach was used as well in managing the pandemic and in the issuance of vaccines, perhaps how much was this a part of the success of your efforts?
Well, for us, national security is the stability of our economy. And the national security is the fact that the numbers of unemployed people in Israel, the peak reached more than 35%. We're speaking about a country that before COVID, we are one of the top 20 economies in the world, if I'm not wrong. Our GDP per capita were close to $42,000 per capita before the COVID. Then suddenly, from 5%, we moved to 35% unemployment. What a challenge for the private sector. Government sector, was functioning, but the private sector, especially entertainment, hospitality, tourism, they were hit badly. By the way, the same in the Philippines. And then this is an issue, so the government needed to open its pockets, and we did so. The government usually is very cautious in spending money, which is normal. And we did what we did. And by the way, we increased our deficit dramatically, and there is nothing you can do about it. And now we see when Israel goes out of COVID and we're out, the economy is booming in Israel. Booming. Unemployment went down, if I'm not wrong, I saw the last figures, less than 8%. We were 5%. 5% unemployment in Israel is actually full employment, because there is 5% that will never participate for many reasons in the working force. So the economy is booming, and it goes really bilis, not the hand. It goes very, very fast. There is a government promotion for internal tourism, in order, because lack of tourists from abroad, we see it a lot. Restaurants are full, coffees are full, sports events, tens of thousands of people went. There was the final of the Israeli soccer league. 30,000 people attended the last game of the season. So I think this is the again, you can't shut it down. You can't shut the economy down.
How much of a role did the military, did Mossad have in the distribution, the logistical aspect of the vaccination?
The army was deeply involved, because especially there are two elements. First, to make sure that soldiers won't be sick. So the army have his own. By the way, it's the same here, and I know that in the army and the police have it. But the army, we have a home front command in Israel. The home front command, and at the beginning, the testing sites, before vaccines came, we needed testing sites were managed. Many of them were managed by the home front command. But then the HMO steps in, and together with them, we could do the testing site. Distribution of the vaccines, it's only the HMOs. Only the HMOs. The 4 HMOs perfectly, worked out perfectly. And few hospitals have a little bit. So they were important. They were very, very important. But the main issue was getting the vaccines first at the beginning. And we did so. And I'm very proud of this.
I spoke to a diplomat who was posted in Israel until late last year. And he says that, well, in the beginning, the populace was really very resistant to the imposition of a lockdown, of social distancing, wearing masks, all these restrictions on movement.
Yes.
Even as we know that, Israelis are known for their rational thinking, very science-based approach to the economy, to business, to life. Why was there this resistance, even if there was that scientific basis for it? And I find that there's some kind of contradiction, and I'm interested in how this was managed, because there's no vaccine resistance, there's no anti-vaccine thinking, because of, I guess, the science-based approach of the populace. But yet, when it came to lockdowns and restriction, there was.
I tell you what's the Israelis are very opinionated. And Israelis, I think here there is more discipline than Israel. Our mentality is, all of us goes to the army and we challenge our officers and our leaders. This is Israel, this is part. And really the issue of discipline, it was very tough. Social distance in Israel comparing to here, I can tell you here, I see how people standing online for the bus. In Israel, it was the same. We are not.
Are you saying we're more disciplined?
Here, 100% more in general. Wearing masks. We are not used to it. We don't have it, So that was a challenge. Social distance was a major challenge. But I tell you how we do it. That's how we did in Manila. After a while, when we understand there's a problem, we're working in capsules, team A, team B, managing very smart. I think that helped a lot. But part of the challenges, especially when we have the spikes, is lack of discipline. Lack of discipline. And that was the challenges during certain periods, but I think people realized, especially when they saw that people are dying. We have more than 6,000 Israelis that died, don't forget. During that vaccines and social distance saves life. We had altogether 800,000 people, 10% of them became sick. 10% of our population, it's a big number, most of them mild, but still 6,000 people died, which is an enormous amount of every life that died. So it's enormous amount of work. And then the going out was amazing. Suddenly from today to tomorrow, life is so normal and thriving. And Israel is also, when we had conflicts in the past, we move very fast to the next. This is our history. It's like, so COVID was there and that's it. We finished. We are to the next stage, even though I stress we need to stay vigilant. Yes, you can never know, a variant will come, so there's still, but totally life is almost 99% normal.
Well, you skirted the question about Mossad. Did it play any role?
No, I think, I'm not sure. I know that some of the defense establishment in general were involved in getting we had a lack of, I think it was the army, by the way, lack of ICU machines at the beginning, I think. So, but I'm not aware of it. ICU machines, but I'm not aware of it. I just don't know.
Mm-hmm. So from the onset of the pandemic, when perhaps there was really a struggle to manage the situation, you have completely rebounded.
Yeah, correct. And by the way, here in the Philippines, what kept us very busy the first 2 months is getting out the Israelis back home. More than 1,000 Israelis were in the islands, Camiguin, Shirgao, Sikior. That was a challenge, but we did so. So the government puts itself a goal to assist every Israeli that wanted to go back then home. And we did so. Life now is totally normally back. Is like there was no COVID. Schools, whatever, life is normal, and you are invited. Life is normal. I hope it will last. Very normal. I know that some European countries are struggling with this, but we did it again. The main issue now is vaccines. Please be vaccinated whenever you can. And I'm happy, Cecil, that you are vaccinated already.
I'm not sure though if it's accepted. My vaccine is accepted as a vaccine passport in your country or in other countries. Another question is the cost. No, you when you secure the vaccine in December, you had to pay many times more the actual price.
It's worth, I don't know exactly what we paid, it's worth every cent that we paid. We don't need to run after vaccines. We have the vaccines. We have the good health system. I don't know how much we paid. If we paid more, in my perspective, this is something that government should spend money. It saves life. You know, we spend a lot of money, and again, it's something that was done, and it's highly appreciated by the Israeli citizens. The fact that the government was enabling them to be vaccinated. We have Israelis, including from here, flying to Israel just to get the vaccine, all over, with their some with their Filipino spouses.
You can get a vaccine if you travel to Israel.
If Israelis and also Israelis automatically, and also if you are a spouse or whatever, there is an arrangement that you can have. We have several here from the Jewish and Israeli community that did so.
Mm-hmm. And you got your vaccine as well. You flew back home to get your vaccine, and there's no fear of this is the struggle even in the United States of now it's slowing down the vaccination campaign because of those who refuse to be vaccinated for fear of incurring more disease or the side effects.
Yeah. Well, first, there is a big population which is not vaccinated, children. Don't forget. This is so we have a few millions that can be vaccinated. Now they allow 12 to 16 years old, and again, just to. If you put COVID aside, before there were those that anti-vaccines with measles and other things. We know it from the past. It's not something new. But I think that the government campaign and the role model of the leaders, and especially the practice that vaccines save life. We see it. You know, I remember when I took the vaccine, I was at the second day they gave the vaccines in Israel. Me and my wife were vaccinated. And there were, all of us have questions because we didn't know about side effects. There was no experience. Now we have the experience. And we know those vaccines are working very well. I speak about Pfizer in Israel. Very well. It's being tested. So we are behind it,
You have tens of millions of cases.
Yeah. And you see it, and it's a great vaccine. And the expert says maybe it will be like flu in the future. You have to get it once a year, but it's working. It's working, and that's why the numbers of people that are refused to be vaccinated went down dramatically. Working place in Israel, for example, now there is no capsules anymore. And I can tell you one, if we try to draw a lessons from COVID, is that we can work from distance. We could spend less time on traffic and pollution. For example, this interview would be normal days would be physically in Manila house. Now we do it for Zoom. But so it's still they enable the government of Israel. They still do 1 day a week. You can work from a distance because they understood it can help if you have the equipment and the possibility to work. So it's something to balance it. It's an opportunity, and I hope we can seize it. Definitely a second lesson that we have learned that we need to strengthen our health system. This is very, very important. Budgets has to go and strengthen. This is 100% clear for me. Let's speak about Israel.
Mm-hmm. Well, since you are packing your bags and leaving soon, perhaps you can be a little more candid in assessing the Philippine government's way of handling the pandemic and, of course, the vaccination program.
I'm not in a position to give advice to the Filipino government. I'm a diplomat, so I can't give advice to the Filipino government.
Mm-hmm. Mm-hmm.
This is
what best practices you think though can we adopt without having to assess just what is doable in, for instance, you talk about the home, I forget, it's like a home care
HMOs. HMO.
No. Something related to national security and managed by the military, but in a more civilian, perhaps, manner.
Home front command, what we call
home front command.
But that's not the element. You can't compare Israel to the Philippines. We are 9.3 million people. less population than Metro Manila. You're an island. You can't compare. And you have OFWs. It's non-comparable. So you can't compare it. And I see, and I'm encouraged to see that things really are moving forward. And I think what is similar between our two countries is this approach of cautiousness with the economy. You know, we can close the countries for months, but you need to move the economy. The same in Israel. This was the dilemma, and there is no textbook for this. There is no textbooks for this. What we know that the virus has no borders, and that's why we need the international cooperation. That's why we shared all this info with the Philippines, and we're bringing our top expert, as I mentioned, next week here to share our experience. By the way, there are things that we should learn from the Philippines. You know, it's not just that Israel, and we had also our shortcomings in these waves. We have first wave and second wave and third wave, and the problem of the airport was major problem, how to manage it. So all of these were challenged. Now it's working well. You land, you don't see even a person. You do a test in a machine, it's all automatically. But
we did place our order at the same time Israel did in December. We made the moves as early as December, except that we dropped the ball somewhere, and we did not secure the volume of vaccines needed to achieve what Israel has.
But again, you can compare. We are 9 million, and don't forget 9 million. Among them, those that were eligible to be vaccinated is 7 million. You can't compare it. Yeah. It's not comparison.
We are a very huge population.
Yeah, you can't compare it. We are Metro Manila in the population, so it's not comparable. I don't think it's a good comparison. But Israel was, because of the size of the country and the size of the world, we were a great laboratory. And with unique, what is unique is our healthcare system, public health insurance, which is mandatory. And I remember how when it was this legislation passed in the 90s, there were criticism, whatever, and now we see, and we are, by the way, so proud now, so much proud about this health, 4 HMOs that were created, most of them before the creation of the State of Israel. That was the basic with all of them. And we are very proud of them because they are the one that brought us to this situation, which is amazing.
So that is really truly the backbone, the strength of the health system. The
strength of the HMOs, I would say, I mentioned because, but this is a process. Listen, in order to do this, Israel has to go a national health insurance, which everybody pay. It's a complicated process, and then to have the HMOs. It's a lot of, in the other countries, I was serving all over the Western world. Very few countries have such a thing at all. So it's a unique thing, which again, we are willing to share the experience with the Filipinos, with our Filipino friends.
Ambassador, I do not want to monopolize the discussion here and the questions. So, well, we have a couple of questions. Unless, shall I read the question, or would you like?
Sure, read the question, please.
No, perhaps Florence, would you like to ask the question yourself?
Florence, I can unmute you if you'd like to ask your question. Okay, maybe not. Okay. I can read out Florence's question. Let me read out the question.
Correct me if I'm wrong. New Prime Minister was installed. How do you see his former government towards economy and health programs and OFWs going forward?
Well, Israel has, for the last 12 hours, we have a new government. And you said yesterday, I went to sleep. We had the democratic elections, Prime Minister Naftali Bennett, a new government, just a few hours. Relations with the Philippines there is a consensus in Israel about the importance of this. And definitely one of the pillars of these relations, and was spearheaded by President Duterte. I was his official escort of President Duterte when he made this historic visit. We'll never forget, on September 2018, first ever Filipino president visiting the Holy Land in office. And we signed this historic agreement about the regulation of working conditions for the OFWs. Israel, we have a very conservative policy on OFWs. We can't have yayas, whatever. only caregivers for elderly people at need and people with disabilities. And number one is the Filipinos. That's why we love so much the Filipinos. They take care of our most beloved people. And just 1 month before COVID started, we also agreed on having 2,000 Filipinos to work in the tourism industry. It didn't materialize because there was the COVID came. So hopefully afterwards we can come back to it. But we need, and I see the numbers of OFWs that travel every week to Israel is growing because there is a need for this. And they are the best in the world. So there won't be any change. They're getting paid, you know, they are very regulated. We treat them well. They get paid well. They have their pensions, the days of the churches. You can eat balut and halu halu in Tel Aviv restaurants. Why to say this? So it will continue. About the government policy, we know that about economy, whatever. I saw the speech of the new prime minister. It's going to be a main issue to boost the economy. He mentioned that one of the goals of the Israeli economy, that 15% of the working force will be in high tech. You know, the engine of the Israeli economy is the high-tech industry, but the number of those that are employed there is not proportional. It's too low to those to the part of it, the huge part it has more than 50% of the Israeli economy. So this is a lot, and helping those that were hit by COVID that are still. So a new government, and let's wish it all the best. And with relations with the Philippines, they're just growing and growing. I would just add that during COVID, usually countries are not expanding the diplomatic missions, and actually they are sizing down. Here in Manila, which the only embassy of Israel is that I know that grew dramatically. We opened a defense attaché office for the first time in our history in Manila in August last year. In September, we opened our economic mission and trade mission. And also in September, we opened our honorary consulate in Mindanao, based in Davao City. So this is happening at once. It's not every day, so things are doing very well.
Mr. Ambassador, another question from Florence C. Curious as to how many people refuse the vaccine after incentives, like you were saying, entries to concerts, malls. How did the
Well, I don't know how many refuse, but first in Israel we have people that get the first vaccine. Almost 100% of them get the second vaccine. This we don't have. Well, we don't know because they need to register. If you want to be vaccinated, you need to take action. You know, actually, no, you get it. So I don't know, but there are hundreds of thousands of people that still are eligible to be vaccinated. But don't forget, we have 800,000 people that were sick. Okay, so here this is a tricky issue. And now, according to the regulation of the Department of Health, if you became sick, 90 days after you recover, you can get one shot. Okay, so this is also a significant amount. But most people that I know, almost all of them are vaccinated. But still, there are numbers of people. It won't be 100% of the eligible ones.
There are few holdouts. There are few holdouts still.
Yeah.
Mm. All right. Any other questions?
Maybe I just wanted to ask as well, Ambassador, thank you for all that information that you provided. Has Israel been able to trace who patient 0 was for COVID?
No, well, it's interesting because the first case of Israelis that we knew that were sick were a group of Israeli tourists on a Japanese boat, on a cruise boat. It was well known in Japan. So but that was before COVID came to Israel. Actually, Israel was almost the first country in the world that shut down flights from China when it started. But then, because Israel is coming from all over the world, that's where we got the South African variant, the Brazilian variant, and the less with the Indian variant. Patient 0, very tough. There were few, but it's all you can't prove it. Here and there were few. I remember when the first cases arrived, and then, but the magnitude we had in one specific day, almost 10,000 people new sick cases in one. Now there's maybe 1 or 2. You know, it's not nobody following. It's hardly an issue to follow in the news, which is great. That is great. But what we paid the price, 6,000 people more than died. It's a number. And I have actually friends here in the Philippines that lost their life.
Yeah.
that made their soul rest in peace. Good friends that lost their life from COVID.
And are there any studies with Pfizer for children to vaccinate?
Yeah, now, well, we are now starting. We opened it for 12 to 16 years old. It's just new, just 2 weeks ago. And with here, there is no urgency, but it depends on the parents and the children, and there's this discussion. But it goes, you know, it goes and slowly. But they're being vaccinated because it helps a lot in traveling abroad and to prevent sickness. And so we started. We waited, and we usually follow the FDA guidelines. This is generally Israeli policy. So all the international airlines are returning to fly to Israel now. So if you want to fly New York, Tel Aviv, there are so many airlines that are flying. And I say, and I hope that PAL has announced it, and we are looking forward to a historic decision to fly to Israel in October twice a week. This is very important. I can tell you that the Israelis, I see it in the Facebook groups, eager to go back to the Philippines. That's when the Philippines is going to be open. And Israelis come and they spend money and they enjoy the interactions with the Philippines. I think what we see with the vaccines, it's the victory of science, technology. Really, this is amazing. We didn't have any vaccine, and suddenly, look what technology and science can change the world today. Really change the world, and we all need to learn the lessons from it.
And also a good information campaign.
Yeah, we try. Yeah, very important today with social media. It's there is upside and downside. You know, you need to, fake news are all over, but yeah, generally yes. I agree.
And are children back at school? Physical face-to-face?
It's the triumph of science and political will.
That's
Countries that have managed well have demonstrated strong political will in dealing with a crisis.
And Israel's unusual because there's not a woman at the helm, right? Isn't that the theory that women world leaders, you know, political leaders who were women tended to, you know, manage the COVID crisis in their countries better than men. So Israel is the exception, I think. Well, that's one theory. But are children back in school? Sorry.
Yeah, normal, like normal university. That's it. It's over. It's over in Israel. Normal life. No mask, nothing. No,
but there are 0 cases that of COVID.
I think they are. You see, they don't follow it. There are still some active people that are. They are still, but the numbers are minuscule. I can Google it, but it's not. You have to look in the papers or website to find. There are very few cases. They are. We might have few tens of cases, and that's it. It's very low case.
There's a phenomenon of long COVID, right? Some COVID sufferers have recovered. They don't test positive anymore, but they still, you know, there are after effects, lingering after effects.
They say.
Are there any cases?
I don't. They say it. I saw reports, but I haven't seen much reports about it in the Israeli media. And I think it's a bit too early, by the way. We need to see. That's why we signed these agreements with Pfizer and Moderna for a third dose, because some of the experts think that it's something that will, because of the variants, and you see there are countries in the world, in Europe, in Asia, in Africa, in Latin America, that the COVID is actually getting stronger. You know, so we need to be prepared, and that's why we put this investment of assets for 2022 in case that will be needed. I think it's important, and I believe personally that it's worth doing this investment to be prepared, because really we saw that it's very tricky with this virus. That's why I'm always very cautious, saying it's over, but we need to stay vigilant. And I'm not a Department of Health guy. I'm a diplomat, so for them they will say, but they're all going to be here next week. The experts, Israeli, probably they will be all over the Filipino media to share their experience with the Philippines.
So for Pfizer, you didn't have much. For Pfizer, you didn't have. Sorry, one more question. You had to prepare in advance, right? Because of the refrigeration that was needed, the temperature for storage. And
yeah, but we have it in the HMOs. That was hardly a non-issue in Israel, and we are. We are not an island country. In Israel, from north to south, it's 400 kilometers, so there's no problem to move or to store, and we have there's no problem of electricity or signal of internet. You know, it's in Israel we have it, so that wasn't the issue.
That's good. Sess?
Well, I was just about to say that, they've become such, you've set the bar really for countries around the world. An example that will inspire us to do better. I hope our governments around the world, because really it's the economy that has taken such a beating. So many people have lost their jobs, businesses had to close shop. It's a huge struggle.
And I would add the emotional, psychological element for children that stays home for so many months in Israel, studying in Zoom. It's very, very tough. Families, it's a challenge, opportunity, but a challenge. I agree with you. That's what. But it will be over, I'm sure. Also here, few months, things will get. The direction is very, very clear, and I'm optimistic.
Yeah, I think it's picking up here, no, Sess? The vaccination program is picking up. Hopefully. It seems to be.
Much to be desired, especially in the provinces.
Yeah.
And that's where the surge in cases are now happening.
Yeah.
Outside Metro Manila. So,
yeah.
Hopefully, we'll get better. But
on that, yeah. Go ahead, Sess.
There are no more questions from the floor?
See any more questions? So I think on that note, that's been very inspiring, Ambassador Harpas, and we wish you the best in your new posting. Are you ready? Are you able to disclose, or you're going to?
I'm going back home. I'm going back home for a few years, which is the best thing. The disclose. Come and visit me in our capital, Jerusalem, the headquarters of the Israeli Department of Foreign Affairs.
Well, you're going home at the right time. I mean, it's all open now, at least in Israel.
Yeah, we're looking forward. To walk without a mask outside will be very nice.
And hopefully, the flights of PAL will put through in October.
Yes, I take note that you have to visit Israel. We take good note of this.
I am embarrassed to admit that I have never been.
Yeah, excellent. Thank you very much for having me. I really appreciate it.
Thank you everyone for joining us. Thank you so much, Sess, for moderating today. It's been a pleasure to have you. And you too, Ambassador Harpas. Thank you, and we'll see you again soon. I hope you enjoyed your calzone or your Thai food.
Thank you. Thank you very much. Thank you, and God bless.
Yes, thank you for joining us, for our members today and guests. And please remember that Manila House is open. We've got a lot of outdoor space, social distancing, it's safe. And so we hope to see you there. And we have our Thai food, which is becoming more and more popular. So please come see us.
Thank you.
Okay, thank you. Thank you so much. Thank you, everyone. Thanks, Sess. Okay. Bye.